According to the Skin Cancer Foundation, skin cancer is the most common form of cancer in the United States. About 3.5 million causes are diagnosed every year. Today, we will talk about skin cancer, how it is contracted, who is most susceptible, types, treatments, and prevention. So what is skin cancer? Simply put, it's an abnormal growth of skin cells. It doesn't sound too harmless, but how do you get it? You get it from sun exposure. The UV rays that the sun produces cause mutations in your skin cell production, which can form malignant tumors. I myself, as many other dark-skinned individuals, have previously believed that we can't get skin cancer because of the melanin, the amount of melanin that we have in our skin, which does provide some protection from sun damage. However, according to Maritza I. Perez, MD, the Senior Vice President of the Skin Cancer Foundation, anyone can get skin cancer regardless of race. So that leaves, well, who's at risk? Everyone is. No one is safe. And here are some facts and statistics from the Skin Cancer Foundation about it. Squamous cell carcinoma in blacks tends to be more aggressive and is associated with a 20 to 40% risk of metastasis, which means spreading. Squamous cell carcinoma is also the most common among blacks and Asian Indians. People who use tanning beds before age 35 increase their risk for melanoma by 75%. And basal cell carcinoma is the most common cancer among Caucasians, Hispanics, Chinese, Asians, and Japanese. As you can see, these stats reference different types of skin cancers. So let's go over a few of them. Actinic keratosis is also called precancer, and it's simply just a dry, scaly patch that you can see on your skin. It usually stays about the same color and is found on the areas most commonly exposed to the sun that we least likely check, like our scalp, our face, and our shoulders. Basal cell carcinoma is called this because it originates in the basal cells, which are found in the epidermis layer. And it's the very top, but it's the bottom. So as you can see, it's your muscles, then your hypodermis, which is the fat layer, then the dermis, where all the blood cells and the hair follicles and things start. And then there's the epidermis, and at the very bottom, there's your basal cells. And it grows pretty slow, so it's least likely to spread, which means it's easier to treat. Squamous cell carcinoma looks very similar to basal cell carcinoma, but it bleeds. It tends to itch really bad, and then when you scratch it, it bleeds. If you leave it untreated, it can spread into other areas of your body. Melanoma is the least common form, but it is the most deadly because it grows so quickly, and it's the most likely to spread to other areas of your body. If diagnosed early, you only have to remove the lesions. Now, when it gets into you not treating it or you not paying attention, that's when it spreads, and then you need more aggressive treatments like chemotherapy. I'm sorry. So here are some ways to remove the lesions. We have cryosurgery, which means you just freeze it off, kind of like warts. There's also curettage and electrodesiccation. And so that's when they take a curette and they scrape it off, and then they take an desiccation needle and it burns off any other possible additional cancer cells. And there's also creams, and these are their names. I have never ever heard of these names. And it takes several weeks for it to remove the lesion, and they usually only use it for actinic keratosis and superficial basal cell carcinoma. And there's also excisional surgery, where they use a scalpel to remove the lesion, and then they biopsy the tissue around it to see if there's also additional cancer cells, and if they are there, they repeat the process until it's done. The only way to eliminate the risk of getting skin cancer completely is to not use tanning beds and avoid the sun completely. But since we need the sun for, vitamin D production, these are some ways to protect your skin. Stay in the shade between 10 a.m. and 4 a.m. Those are peak sun hours. So if you have to go out, seek the shade. Make sure you use a broad spectrum UVA, UVB sunscreen every day. You're supposed to apply 30 minutes before you go out. The higher the SPF, the better. But at least 30. Also, if you're swimming or you're active or you're sweating, you have to reapply it immediately. So as soon as you get out the water, it's already off your body. You got to put it back on. Otherwise, you just reapply every 2 hours. Make sure you cover your skin as much as you can while you're out. Wear your hats. The bigger the brim, the better. It's my little sun hat. And wear your sunglasses to protect your eyes also. It's very important. You can get skin cancer in your eyes. Have your doctor examine your skin every year from head to toe, all of it. And then also do skin checks at home on your own. Look for moles, freckles, raised rough patches, anything that you've never seen before. Go to your doctor and have them check it out. Also, it's important to know your ABCs of your moles. A is for asymmetrical. A healthy mole is symmetrical. If you split it down the middle, it should look exactly the same on both sides. B is for borders. Healthy moles have smooth borders. So it should be no extra edges, no rough, scaly, scalloped, none of that. Just smooth. Also, the color. It should be uniform in color. It should be, and appearance also. Diameter. It should be no larger than 6 millimeters. That's about the size of a pencil eraser. And evolving. You have to look for change in moles that you already have. So if they begin to grow, they develop new irregular borders. If the color changes, get to your doctor as soon as possible. Most people enjoy a day in the sunshine, so it's important to know how to protect yourself, and that UV rays can be very damaging to your skin and your eyes, which can lead to cancer. So be sure to check your skin regularly for strange looking or new moles or freckles, lesions, growths. And also, the earlier you catch it, it's easier to treat. So remember also, no one is exempt, and the Skin Cancer Foundation says it can affect anyone. All ethnicities are at risk. So let's be sure that we do all we can to protect our skin, as it's the largest organ in our body. Thank you.